Good afternoon, everyone, and welcome to A Gathering Place, brought to you by the Gullah Geechee Chamber of Commerce. And we have special guests today, Dr. Winston McIver, Dr. Leslie Bessellieu, and Dr. Thaddeus John Bell. They are here to talk about the rising COVID-19 numbers in South Carolina and the psychology behind why folks are not wearing masks and why we're not practicing social distancing. So let me go ahead and introduce our special guests. And first, I want to introduce Dr. Leslie Bessellieu. Dr. Bessellieu, thank you for
Hi,
joining us today.
thank you so much for having me.
All right, looking forward to hearing from you and what's going on in South Carolina and our nation right now. And also, we have with us Dr. Winston McIver Jr. Dr. McIver, how are you doing today? You're on mute.
Good to see both of you all.
All right. Yeah, I kind of threw you off, right? So, folks,
Yeah,
we had little technical difficulties going
okay.
on,
We're
but we're
good.
here getting started. So,
We're good.
very
We're
good.
good.
Good to see you, Dr. McIver. Dr.
Yes.
Bell is on his way in, folks, and he will be joining us. But we want to thank everyone for joining us today and to remind you if you have any questions about the coronavirus or COVID-19, drop them in our comment section and we'll get to those questions and get those answered for you. But to begin, Dr. McIver, do you happen to have any numbers for us regarding what's going on in South Carolina and the nation?
I do. I do.
All right, very good.
So since since Friday in South Carolina, the number of cases have gone up from a little over 16,000 to around 18,795.
Wow.
Right. So
Wow.
that's an increase of about 2,000 and 2,300 in the last 48 hours
Wow.
of cases.
Wow.
Actually, in the last 72 hours.
Okay.
When
And
we when,
since Friday.
when we talked on Friday, the numbers weren't released as of that time.
Okay. All right.
So,
Very
so,
good.
so gone from a little over 16,000 to over 18,000 cases. And the number of deaths in South Carolina has gone from 588 to 600 deaths in South Carolina.
So the numbers are rising.
The numbers are rising. And we'll talk about that in a little bit about the numbers rising and what that really means.
Okay.
In Horry County, since Thursday, the number of cases have gone from 800. Number of positive cases have gone from 849 up to 1,133,
Wow.
and there has been one death in the last 48 hours. In Georgetown County, the number of cases have gone from 117 on Thursday up to 164 today. Deaths still the same at 4. And in Charleston County, the number of cases is 1,092 with 15 deaths. Um, Nationwide, we're right at about 7.5 million cases, and the number of deaths. I'm sorry, worldwide, the number of deaths have gone from 426,000 to 434,000. That's worldwide. In the United States, the number of cases are right at 2.1 million, with the number of deaths being 116,000 to around 118,000. Now, the good news is, if there is any, the good news is there has been 3.9 million people that have recovered worldwide, and it has been 820,000 people that have recovered in the United States. So, with social distancing, with mask wearing, although it's not the optimal number of people wearing masks and not the optimal social distancing, but there have been some in the major cities and states that were hit hard, and we are seeing those numbers starting to trend down. So again, with social distancing, with proper mask wearing, we know that we can get these numbers to drop down.
So, Dr. McIver, it is good news that we've had folks over 8 million worldwide who have recovered from COVID.
Over
And
3.9 million people.
3.9 million, excuse me.
3.9 million
And how
worldwide.
many? Yeah.
820,000 in the U.S.
All right, thank you.
Right.
820,000. That was my next question to
Mhm.
repeat that for me. So that is good news, but it is clear that the numbers are trending in certain states, including South Carolina. I've
Yes.
heard North Carolina, Arizona,
Right.
Florida, and it's
Yeah.
quite obvious why.
Right.
The we could say the reopening. Some people are also saying because of the protesting and
Right.
rioting also, but
Right.
I think that may not be included quite yet in these numbers because of
Not
the
quite.
incubation period.
Not quite. That's right. The incubation period is anywhere between 3 to 14 days. Now, a couple things that I do want to say. Now, the numbers we're seeing now, though, would be a reflection of the weekend before Memorial Day, when there were a lot of people in Myrtle Beach and in the area, in Memorial Day. Those numbers that we're seeing now, a lot are a reflection of that. Now,
Okay.
a couple things that I want to say too. In the last 2 weeks, there have been 20 states that have had an increased number of cases. 20 states. Of those 20, 7 of them have been deemed a significant increase. Okay? Those states are South Carolina, North Carolina, Florida, Texas, Utah, New Mexico, and California. Now, as far as South Carolina specifically, um, South Carolina DHEC reported that we've had 770 new cases yesterday, which was eclipsed by 799 today. So in the last 5 days,
Wow.
we've had 5 out of the last 7 days, we've had new highs.
Oh, I think Dr. McIver hit L- Leslie, Dr. Best. I think he hit a button and disappeared on us.
Well, that last statement was
There
pretty
he is. There he
powerful.
is.
So
Look, those numbers were so shocking that you
right.
actually
That's
disappeared
right.
on us.
So
Thank
so
you.
let me let
Go
me
ahead.
let me say that again. 5 out of the last 7 days have
Hmm.
been record high numbers in South Carolina. The previous high was yesterday of 770. Today it was 799 new cases.
Mm.
Okay.
So each day is a new high.
Right. Out
Yeah.
of the last 7 days, 5 of those days were new highs.
Okay.
Okay. Um,
Wow.
that's in South Carolina. That's in Horry County specifically. Um, yesterday we had the single highest day of 101. That was the highest since the pandemic was started. But to extrapolate this further, to look at it further, North
Hmm.
Carolina yesterday reported the highest number of cases they had in a single day of 1,427. North Carolina,
Oh, wow.
1,427. And they had the most hospitalizations since the pandemic began. That's North Carolina. Okay.
Hmm.
In comparison, Florida. Yesterday, Florida had their single highest at 2,500 new cases.
Got
Now,
it.
Now, one of the things that's being seen here is that there's a nationwide trend where we're not seeing the cases as high in the bigger cities like we did initially, because I think they kind of got it. So
Mhm.
now the number of cases that we're seeing now are really hitting the smaller communities, communities of less than 60,000 people. The major concern there is that those places a lot of times don't have adequate medical support. Some places are considered medical deserts. You've got some places that the people have to go miles and miles and miles to go to get medical care, different counties to get care. I think in South Carolina, I think there's either 10 or 12 counties that actually don't even have a hospital.
Hmm.
So
Hmm.
we're seeing the numbers in those areas go up. What's also in those areas? Poorer people, people with more medical conditions, more chronic conditions, people with cancer, people with uncontrolled diabetes, uncontrolled asthma. Those things that all kind of feed into a person being susceptible to getting COVID and to having some problems with COVID.
So these are the areas where lack of access to health care is magnifying the health disparities that magnify coronavirus.
Exactly. Exactly.
So it's just this domino effect that's happening, that's leading to I know I've been hearing the concern of the hospitals being overwhelmed. And these hospitals, I think people think in terms of the hospitals. I have a hospital in my county, in my community, but there are hospitals not just serving your community. If I am in a county that does not have a hospital, I'm traveling to your hospital, to the
Right.
nearest hospital. So now we're
Exactly.
compounding the occupancy of those hospital beds.
Exactly. Exactly.
And we
Yeah.
don't want to get overwhelmed, because then our healthcare workers, such as yourself, are going to have to start making some hard decisions.
Right. Exactly. And again, as and in a lot of hospitals, they're actually still having some issues with PPE. So that's one issue too that is of a potential concern, particularly when you're talking about more phases to this. You're talking about the numbers and that kind of thing. The concern is that I think there's just been kind of a lax attitude about this. And I was reading an article that was talking about it appears that we're done with COVID, but COVID isn't done with us.
Yes.
And
Mm-hmm.
yeah, I think it was in the New England Journal, but I was reading it and it was basically saying, we appear to be done with COVID, but COVID's not done with us.
That's very true, and that's actually why I brought Dr. Bessellieu on to speak to that, because of the psychology behind it. I'm using that term, and I don't know if I'm using it correctly, but I'm sure Dr. Bessellieu. That's why I brought her on as the expert of people are just leaving. They're thinking it's done, and we're not even out of the first wave. So, Dr. Bessellieu, can you speak upon the psychology behind folks regarding COVID-19?
Sure. Well, it really is related to what Dr. McIver was just saying. People are tired of it. And because they're tired of it and they're wanting to be done with it, they're really looking to getting back to normal quickly. And so, unfortunately, with states reopening much sooner than they need to by ignoring the guidelines for when you should reopen, that sent a message. And I believe that that message is it's okay. It's okay to go back out, to work. Hearing that it's okay to go to the pools and social distance, to me, that makes no sense. I'm not quite sure how you maintain social distance in a pool, but there are just so many conflicting messages out there. But you couple that with people's need to get out. And so, we initially have a couple of reactions when we go out into the community and we're seeing all these people out there with no masks on, and they're just kind of walking with their friends in these large crowds. So we're hoping to move away from the outrage that we see. Marilyn, you and I were talking before the show began, and we were saying that um, calling people out for not engaging in social distancing or not wearing their mask or shaming them in some way, that's not going to change the behavior. So even though that may be our initial impulse, it really is important to understand what's going on. So I think there are several factors that's contributing to this. One of which is it's been called quarantine fatigue. So, yes, people are tired of being in quarantine, but it's also impacting people mentally. There was a professor at Northwestern University, Dr. Jacqueline Gallone, if I'm saying her name correctly, but she talks about quarantine fatigue. In fact, she describes it, and I just wrote it down this way, as caution fatigue. And so the idea is that people are showing either no motivation or no energy to comply with safety guidelines. And it's reflected when they're becoming impatient with the warnings. And it's not just being impatient with the warnings, but some people are not even believing the warnings. They're not believing the the statistics. And so this is where you hear a lot of people say, well, more people are getting tested, so that's why the numbers are going up. So people don't really understand what those numbers mean. So I'm really glad to hear Dr. McIver say that he's going to talk about what, the hospital, what the testing really does and how that's markedly different from what we're seeing in terms of, but that's the other thing. People are listening to other folks say the numbers are going up, the hospitalization, they're listening to people saying that with more tests, that's responsible for the
The
large numbers
numbers
that you're
rising.
seeing.
Yeah, yeah,
let me
yeah.
address
Doctor,
that.
And the other
please,
thing,
Leslie, Doctor
okay,
McIver
sure.
wants to just quickly
Let,
jump in
let
on
me
regarding
let me
that.
yeah, let me address that because how you doing, Dr. Bell? That's my
Hey,
mentor,
what's
Dr.
up?
Bell. Gotta say hello to him.
Hey, Doctor Bell. Yeah.
Always got to acknowledge him when he's in the house. So let me address that because that's a commonly asked question for me about the increased number of testing. Okay, so first of all, that's true. We are seeing an increased number of testing. However, over the last 10 days, the number of testing that's been done daily in the state has been about the same, but the numbers are still going up. So that's the first thing to let you know that this is still rising. So it's not like we're seeing a whole bunch of tests that's being done daily. The number of tests across the state over the last 10 days has been about the same, but the numbers are going up.
The
Second,
positive numbers are going up.
positive numbers are going up. Right.
Hmm.
So the number of tests that are being done are about the same, but the positive number of cases are going up. So that's the first thing. The second thing is even though we're testing more, it still doesn't mean that there should be positive tests. So yes, we are testing more, but that still doesn't mean that there should definitely be a number of tests unless the numbers are going up. But the biggest thing, and that's the data that I wanted to see, was how many tests are we doing, and is that a pretty even, consistent number versus how it's going up? And there's no doubt that that's what's happening.
So the numbers, the testing numbers are consistently
Over the
at.
last 7 to 10 days, they've been
Hmm.
consistently about the same number of tests done, but the number of positive cases are
Are
going up
shooting up.
astronomically.
And
Isn't
that's
that-
reflection of people being exposed
Exactly.
to the
Exactly.
virus
Right.
because
Whether they're asymptomatic or whether they're symptomatic, they're still testing positive.
mhm.
So again, yesterday was a record high number for a single day in South Carolina, again at 770. Today it was 799 positive cases in South Carolina. The
You know,
number, yes, sir.
no,
Yes,
go ahead.
Dr. Bell. Go
Go
ahead.
ahead and finish up,
Go ahead, go
Bell.
ahead. You go ahead, Dr. Bell.
Well, I've been giving some thought about the fatigue factor, particularly as it's related to young people. And I think that we are clearly dealing with a new phenomenon when it comes to young people. Believe it or not, I remember being young at one point in time. Okay, and so with reference to watching young people participate in the protest, totally ignoring that COVID is out there and could possibly be a factor for them.
Dr. Bell, move closer to your computer. We lost your audio for a minute.
Okay,
You're there you
is,
go.
is
There
that
you
a
go.
little
Much
better?
better.
Okay,
Yeah.
so I'll repeat. Um, I think that we are looking at a different kind of phenomenon with young people who are protesting and at the same time not really caring about and not really appreciating that COVID is out there. But that really is the perception of younger people. They don't think that they can get COVID, but they are very, very much aware that the racism factor can take their life. So it may mean, and I don't know. I've talked to some of my psychology and psychiatry friends, and they have pointed out to me that it just may be that they really don't care about the COVID because that's something that, at least in their minds, they see in the distant future. but they see the racism and the things that they are protesting against as something immediate and something that can definitely change their life. Now, the question for us, for Dr. McIver and myself and other physicians, is going to be that as difficult as it may, we have to get them to appreciate that there are both imminent problems that could take their life.
That's
So
right.
that's why. Let me have Dr. Bessellieu speak to that also. Dr. Bessellieu, did you hear what Dr. Bell said regarding the young folks and their reaction towards this virus?
Sure. I, I think yes, absolutely. So yes, I think typically their response of feeling that the COVID virus may not be as impactful or affect them as much. We've seen that before when trying to get young people to change their behaviors. So when we talk with young people about HIV/AIDS prevention, when we talk with them about any type of STD prevention or anything like that, we've gotten the same response. There is this sense of invincibility among young people. And so I think that's the same thing that we're seeing in response to this virus. The other thing that I guess I'm concerned about with the protesters is we're seeing a not large number of young people, but we're also seeing people of all ages.
Mm-hmm.
And when we're walking around, when we are looking at who's not wearing masks, it's not just young people. So that's the other thing of concern. I'm seeing people that need to be wearing masks because they are in an at-risk group simply because of their age. So we're seeing older people, we're seeing middle-aged people, we're seeing just people across all ages that are out there that's really struggling. So yes, I do think we need to look at, and this is always the case, what kind of message do we need to send as a public health campaign to young people to let them know that they can exert their right to protest, but at the same time be mindful of the importance of taking care of themselves in the midst of this pandemic. The other issue that I wanted to mention with reference to maybe some of the other ages that's related that's going about not social distancing or not wearing a mask um, is this whole idea of in addition to caution fatigue, part of that is chronic stress. So over the past 3 months, we've all been experiencing this heightened level of anxiety as we, initially tried to deal with what is this new virus that's coming about? Why don't we know what's going on? We're not sure who can get it or how we can get it. So that was the early stages. And what motivated a lot of people into adhering to the safety guidelines was fear because we didn't know what was going on. Over time, however, I'm hearing an echo. So over time now, we've been at this for about 3 or 4 months or so. So people are not getting tired physically of being inside, but when you're in a heightened state of anxiety, that tends to lead to chronic stress and that leads to exhaustion. So we know what that does to the physical body and our organs, but in terms of what it's doing to people mentally is they're just tired, as I was mentioning earlier, of being indoors. They're tired of succumbing and they're tired of this inconsistency that they're getting in terms of information about is it safe to go back out in the world or is it not? And so some people are taking it in their own hands. I talked to someone recently and we were talking about this notion of closed versus open societies. So if you look at some collectivist societies, whether it's Japan or some of the other societies, they tend to conform a little bit more because you think about how their decisions and their behavior impact their families, their communities, and their country. So when their government tells them to stay indoors or a family says, you need to stay indoors or concerned about, and that's kind of how their worldview is. Here in the US, we've got this Western worldview, this individualistic
Mm-hmm.
worldview that says it's all about our rights. We have the right, to make our own decisions. And so, in pursuing our success, in pursuing our lifestyles, we make decisions based on our choices and what's right for us. So when all of a sudden the government is mandating that we act in a certain way, people really get upset. So we've seen this historically. We've seen it when we came up with the mandates for seatbelts. We've seen this when we've come up with mandates for wearing helmets with motorcycles and bicycles. And it's the same principle when you tell people that you have to wear a mask, or you've got to maintain social distance. People are like, you can't tell me what to do. This is my right, American. And so that's kind of where some people are in terms of their decisions, that they're not going to make, they're not going to wear a mask.
So,
So
Dr.
those are some of
Bessellieu.
the things I think that contributes. It's not
Hmm.
one.
So,
Mhm.
so Dr. Bessellieu, and I'm going to segue this back to Dr. Bell and Dr. McIver to answer. And I'm glad you brought up those examples of the seat belts, but those are things that impact the person who's not wearing the seatbelt. Maybe some people in the cars, but it's not a pandemic that impacts our individual behavior. Exposes up to 400 plus people. One individual can expose up to 400 plus people with the virus because of our individual decisions. So, as physicians, Dr. Bell and Dr. McIver, I'm going to throw this back to you. What is it that you can do as physicians where you're on the ground with your patients to discuss this behavior or help people make better decisions? Dr. Bell.
Well, the thing that I try to do, particularly when I'm talking to my younger patients, I try to appeal to them. If they don't care about themselves, then they have to care about their grandmama or perhaps even their mother. And I have to make them aware that their behavior could, in fact, affect the outcome and the outcome of their family, of their family members. So that's what I try to try to talk about.
Try to stress
So,
to your patients.
I
Yeah.
want I want I want to point something out to you. The other day, I participated in a march,
Uh-huh.
Hmm.
the one that was in North Charleston, and I social distance, and of course I used the mask. But as I participated in that march, I reflected on the time when I was 20 years old. I participated in a similar march at South Carolina State College during the early civil rights movement. Okay. Now, during the time that I participated in that, I was clearly a younger person. Only thing I had on my mind was civil rights and racism and etc. Now I'm 50 years older, and now I got on my mind civil rights, but also I got on my mind pandemic. And the point that I was trying to make is that that's a so I can clearly look back and see where even at 70, even at 76, I'm a little bit more stressful than the fact that I was when I was 20, because now I got more things to consider. And the point that I was trying to make earlier is that I certainly don't condone what young people are doing, but I certainly have an appreciation for why they may not be thinking
Right.
like I would be thinking now that I'm 50 years older.
Right.
And so my point is that even when you look at television and you see what's going on down in Atlanta, you don't see very many people in my age group walking around without masks. But you see a plethora of people walking around who are in college, who very well may be 30 and younger. So that's the point. That's the point that I'm trying to make. But clearly, what I try to do when I'm talking to my patients is I try to remind them that while they may not care about themselves, and they should, they have to be concerned of who they are going to be in contact with uh, when they go home.
Right.
Yeah.
Yeah. One of the things that I try to do, and I was a part of a march also 2 Saturdays ago. It was a smaller march at the courthouse in Conway. We probably had about 40 people at the rally and probably about 20, 22 that actually marched. And pretty much I'd say 90, 95% of people had masks on. Um, Ironically, I was almost the oldest one there. I don't think I'm that old, but I, I was about the oldest one there. Um, and again, to answer Marilyn's question, and you're right, Dr. Bell. I think at different stages in our life, things become more important or more front and center in our mind. But to answer Marilyn's question, and partly along what you were saying, Dr. Bell, what I kind of look at is just educating folks. In other words, I'm big on numbers, not just because I'm a numbers guy, but because I think that's one of the most effective ways to reach people, especially young people. When you're talking about numbers, figures, dollars, and cents, you usually can get a young person's attention real quick. So when I start throwing out these numbers and giving it to them, I can kind of see their eyes light up a little bit. You say that again, Doc, say that one more time. And then they're hearing me as opposed to me just talking and talking. So I think that's one of the avenues that I've found just for the people I'm interacting with, just to give them hard numbers. You know, one of the numbers, and let me give you this, one of the numbers that has come up this past week in studies is that for the first time, South Carolina has gained twice as many new cases as the United States. Now, let me tell you how they came up with those numbers. There's 2 ways. Number one, they did a scaling down of the United States numbers compared to how many people are in South Carolina. And based off of that scaled down population, there were 333 new cases in the United States and 700 new cases in South Carolina. When you start hearing numbers like that, people hear you. The second way that they look at it is in terms of per capita, per 10,000 people in the United States compared to South Carolina. The U.S. had an increase of 0.6%, whereas South Carolina had an increase of 1.3%. That's twice as many. So when those numbers come out, those facts and figures come out, which I always make sure I can back them up. I always come up from a reliable source. People tend to hear. My younger patients tend to hear. The older patients are hearing me anyway, I believe. The vast majority of them. But the younger patients can deal with numbers, figures, and things like that. And when I find data like that, it becomes like, okay, this is real.
So we have the data, and but the issue I'm seeing and hearing is how do you ramp it up for mass communication? I think that the gap becomes not that we don't have the data and we're talking, but you talking with somebody that's more one-on-one talking with your patients. How do we ramp it up so that we have mass communication and reach more younger folks? And Dr. had this conversation a few weeks ago, but Dr. McIver, how do you ramp up so you have mass communication
Shows
with the
like this.
data?
Shows like this. That's why I agree to do them. Putting it out on social media. That's why I agree to do it. We're on your show right now, but I've shared it on my Facebook page. So I've got at least 40 or 50 of my friends on Facebook who've been off and on. So if it's on their page, then other people may be seeing it too. That's the power of social media. That's the exponential growth, the exponential reaching of social media for free. So that's the reason why it's hard to tell you no, Miss Marilyn. That's the reason why it's hard to tell April no. That's the
And
reason why
yeah.
it's hard to tell folks no when they ask me to do this, is because that's another platform that I have, or that Dr. Bell and I, Dr. Bessellieu have, to reach people. And then even if
So
other people don't hear it, they can pass that message to other people. And they pass it to other people. Just like the virus is spreading, the message can spread as well. One more thing I want to say on that. Also, when people are having these rallies, which I agree with protests, I think protests are good. I think marches are good. I think it brings awareness to what's going on. But those organizers need to stress these masks. It's hard to social distance during the march. It's hard to social distance during the rally, but you can put a mask on.
Mm-hmm.
And so I think you've done a great job with that, Maryland, with what y'all did in
Mhm.
Georgetown. I
Mm-hmm.
think that the people here in Conway, we had two rallies last Saturday. I think they did a pretty good job. Good job. But people still have to pass that message.
So, Dr. Bessellieu, this speaks to changing behavior. And so this is just one example of we did do a march rally in Georgetown, and we emphasized on everything: wear your mask. And we also were prepared because Thailand's Health came out and provided masks for us. And it was a public relations move on their part, but that's a good public relations move too. But what are other things we could do, Dr. Bessellieu, to help change this mindset that's out there, this behavior, so that the virus does not get ahead of us? Because it's clearly expanding and moving rapidly. What can we do to even ramp up even further beyond what we're doing here today? And it was not a shameless plug. I did not pay Dr. McIver to plug this show, but thank you, Dr. Mac.
You're welcome.
Dr. Vassalou.
Well, I'm not sure what more we can do aside from look for different ways of spreading the word, because the challenge has been that with social isolation, people no longer have their normal social cues about what acceptable behavior is and is not, about which news reports are valid or not. So a lot of people have been navigating all of this on their own. And so, if you take your own thoughts and beliefs, and then, you don't know anybody personally that have had the virus, then that kind of continues. It reinforces your own perception that, well, this whole virus thing, it's not that big a deal because nobody in my circle has it. So this is why I think it's important for us to go ahead and continue to rely on social media, because everybody has a phone. Everybody's plugged into their phones. They're plugged into some way of, figuring out what's going on in the world through social media. And I think we just have to continue to reach out and spread the word, so that these folks who are by themselves can recognize, no, it's not just for someone in another country or in another state, but it really is impacting people in this state, in this city, in your community. One thing I can say is I was really pleased that I went to Publix. And Publix, usually I've been saying, I can't believe people are in here without their masks. But when I
Mm-hmm.
went this afternoon, I noticed the majority of people, the majority of the shoppers like me, had their masks on, and then have commented to my mom when I came back, and she said, oh, they're hearing that the numbers are going up. I'm praying that's why they did. But I'm seeing some small degrees of change. But I think that's what it's going to take, because we
You
just have to keep getting the message out through social media.
and from a marketing point of view,
Hmm.
because with my marketing experience, and we also have to take in consideration the day that people shop and the time of day that people shop too, because older people tend to shop at different times. People go after church, for example. Even if we're online, we shop different
Yeah.
habits. We have different habits, so it would
Mhm.
be really nice to see.
Right.
I'm not encouraging you to go to the grocery store every day to do this research, Dr. Besselou, but it would be nice to see if someone did do the research and see what's going on consistently in grocery stores, what's going on consistently like a Walmart, and days and times, and start comparing them. And that'll give us some idea about the people wearing face masks. And I want to go ahead and bring in some questions from our viewing audience here. And Dr. Bell, maybe you can answer this one. Or Dr. McIver, how long after new cases are found does it take for the hospitals to see patient numbers increase? Is that a question that we can discuss today?
Um, yes,
Yeah.
there was a interesting article in yesterday's Post and Courier, and actually it was about one of my patients who had been seen at one of the urgent care centers and got the COVID test done and went back home and waited for them to call him the results. But in the meantime, within 48 hours, he noticed that his symptoms progressed. His temperature went up and his general signs and symptoms went up. So he went correctly to the emergency room, where he was immediately admitted and ended up in ICU, where he stayed for 2 weeks and was discharged from the hospital just a couple of days ago. So the answer to your question is it could vary. One of the things that I would like to remind, particularly African American patients, because we are so COVID. Um, the word that I want to use. We are so concerned about COVID. Sometimes we forget that other things can happen to us that can kill us also. For an example, if you are having symptoms of a heart attack and you decide that you don't want to go to the emergency room because you may get COVID, that's not the right thing. That's not the right way to think about that. Or if you are having symptoms of a stroke, or if all of a sudden your diabetes has gone out of control and you're getting sick as a result of that, you don't want you don't. I understand how you may feel like that, but you definitely want to go to the hospital in a timely fashion. And then one final thing, there are some studies that are coming out now as we look back on um, the cities that had a very high prevalence of African Americans with COVID who got sent home. And those patients, some of those patients end up dying at home. And so now we're taking a look back to see whether or not the profile that we had set up was even the right profile. Or
Right.
maybe some of those patients experienced racism and didn't get appropriately evaluated and admitted to the hospital on a timely fashion.
Right. That's a good point. And the answer that Dr. Bell
Dr.
gave
Bell,
was was similar to what I was going to give. It's a variation in time to the hospitalization because a number of those patients may not even get admitted to the hospital that are COVID positive. So in other words, just because you're COVID positive doesn't mean that you're going to be admitted. If your symptoms are mild, if you don't have pneumonia seen on an X-ray, if your oxygen level is holding fine, but you're still positive, you may get sent home to quarantine and isolate. That's the other thing. Right now, at last count, I have about 14 patients that were COVID positive, and thank God, all of them have made it. All of them
All
live.
right. Very good.
The biggest success story I think is a patient that was in his 80s that had symptoms, and he got admitted. He was on a ventilator for over 3 weeks, was on the hospital for a week, rehab for about 10 days, and he's home now. He's in his 80s, pretty healthy man, but still, probably
High
90%
risk.
of people that were in that same demographic would have died.
Right.
So the hospitalization number is not always a true reflection. However, that's why it's so important when you do see an increase in the hospitalizations, you know that the numbers are going up. Because not everybody with COVID is getting admitted.
And,
Okay.
So
and
very good.
I do want to say this too, because I don't know if this study came out since we talked. I don't think so. It was a study about diabetes and okay. There was a study that was done that looked at 53 different hospitals, and the study design was looked at patients with diabetes and COVID. Within the first 7 days of hospitalization of those patients, 10% of them died in the first 7 days. 20% of those people with diabetes and COVID ended up on the ventilator in 7 days. In 7 days, only 18% of those people went home within the first week. There was a strong association seen with obstructive sleep apnea, diabetes, and COVID. Those people had about a 3 times more likely chance of dying within a week. And those people with diabetes and COVID that were over 70 had about a 14-time higher rate of dying compared to people under 50. So there's a very big association with diabetes. Additionally, another study showed that people who had cancer currently or previously had cancer and COVID were at a significantly higher risk of dying. So all those things are important.
So,
Yeah,
Dr. Bessellieu, you were going to say something also after Dr. Bell.
no, please, I'll defer to Dr.
It
Besselman.
was in
Okay.
yeah, it was in relation to what he was. Yeah, I was just wanting, I think it's unfortunate that, people are feeling as though they're not going to the doctor because they don't want to get COVID when they really need to see about, if they're having a heart attack or a stroke or their diabetes is not well regulated. And I'd like them to, I don't know, but I think it would be great if they could turn it around and think about how can I take care of myself so that I don't have to go to the hospital or the doctor. How can I, make sure that I'm eating well and I'm exercising and I'm, really monitoring my food intake so that my diabetes can be well regulated. How can I do the things I'm supposed to do so that I remain healthy and I don't have to go to the hospital. So I'm really, wish that think about what is within
That's
their
kind of a loaded.
control.
That's
Because
kind of
I'm
a
sure
loaded.
a lot of the things that, Dr. Bell and Dr. McIver tells them to do in terms of
That's the note.
That's a
Yeah.
loaded
Mhm.
question because not all of it is
So
just
anyway,
person,
that's
a lot
that's
of
what
it's
I was saying.
economics. And so again, I'll get a lot of patients that will say, Doc, I just didn't have the money to get my medicine. And I believe if they had the money, they would get it. That's one of the reasons in my office, and I'm sure Dr. Bell does too, is we entertain the drug reps and let them come in.
That's
Now,
exactly
99% of the time when they come in, they're not telling me anything I don't already know.
right.
But I let them come in because when they come in, they leave me samples. And when they leave samples, I can give them to other patients who can't necessarily afford them. So I think it's multiple factors in that. Sometimes people are robbing Peter to pay Paul. I think there is that population of people that are just kind of trifling with what they're doing and not going to take care of themselves. That's true.
It's human nature.
Right. But I think a lot of people, particularly elderly folks, that just may not have that income coming in that they can keep all the ends tied together. And those
And I,
people, I
yeah.
make sure I try to look at with samples.
And I think Dr. Bell can really speak to that because he's dedicated himself through closing the gap in healthcare to addressing these concerns that we're talking about. And I would like to think so. And I think it's more so lack of access to healthcare. Also, income levels do determine access to prescription medicines. Dr. Bell, I know you could speak upon that.
Well, one of the things I agree with my colleague Dr. McIver and Dr. Bessellieu. One of the things, though, that I think that it may be a loaded question, and we have to continue to remind people that just because you eat healthy and exercise does not mean that you're healthy.
Right.
All right, so we have to remember one of the major reasons that we are seeing health disparities is because we're in the 21st century, and we got to get Black people out of the thinking that just because I feel good, I'm good. That's not the case. I can tell you on a number of occasions that people who come in for a routine physical exam and I find 3 or 4 things wrong with them that very well may not kill them immediately, but if they are not taken care of in due time, they're going to be a problem. So I
Right.
think that we have to remind people that even though you feel good, you still need to go in for your annual physical.
Right.
The annual physical doesn't necessarily mean that Dr. McIver is going to do a complete physical on you. He may just want to sit down and ask you a bunch of questions. And based on how you answer those questions, we'll tell him that you're leading a lifestyle that's going to get you in trouble. And so I think that we got to remind African American patients that there must be a change in their mindset. I can tell you that I can tell you the number of people who have health insurance who get sick. You would think that people who have excellent health insurance would not get sick. But people who have excellent health insurance, they think it's a luxury. They don't realize that it's a necessity and
Right.
that you got to use the health insurance.
Right.
One, one of the ways that we find out that people have cancer, particularly black males, prostate cancer, they don't have no symptoms. They go in, they get a physical exam, and they get some lab work. And then the lab work, I have to call them back and say, hey, you need to come back in because your PSA is 15.
Right.
Well, doc, I'm feeling great. Yeah, but you got a lab value here that suggests that something is going on that we need to do something about.
Mm-hmm.
And I think Dr. McIver's point about COVID and cancer is very telling because we got to remember that African Americans have more breast cancer, we have more prostate cancer, we have more cervical cancer, and we have more colon cancer. Okay? And those things continue to have to be screened for, even in light of COVID being out there.
Right, right. And I agree with Dr. Bell. About 6 months ago, I had a patient who came in, normal blood pressure, normal cholesterol, no diabetes. Well, they had diabetes, but it was under control. I did an EKG on them. The EKG was abnormal. This person came and said, I feel fine, doctor. I had to convince them to get an EKG. They ended up with 3 vessels blocked and had to go for bypass surgery. And they said they felt fine. So the point is, like Dr. Bell was saying, is just making sure that these people still go to the doctor. If you got insurance, go to the doctor, use it. The insurance company isn't going to give you a check back at the end of the year saying, well, you didn't use anything, we're going to give you some money back. No, they're not going to do that. So go get seen at least once a year. And then depending on what your labs look like, you may need to do it 2 or 3 times a year to get blood work, but it just depends on what that says. But go see your physician and go get checked.
Right.
I think since the beginning of this pandemic, so many numbers have expanded, and every day you hear something new that we forget certain stories. And I can recall that there was a 21-year-old soccer coach in Italy who died, and at the time they were saying young people couldn't get it or it would not impact young people. It was for older people who would die from it, and he died from it within the week because they discovered he had leukemia, and
Right.
no one knew. They
Right.
had no clue, but because they found out that he had leukemia at the same time, it became a condition that led to his death from COVID. And
Right.
I think people really need to pay attention to the fact that every day we're learning something new about this virus, and you may hear something that at the beginning that may not be true now because research has taken place, and the fact that more people have gotten sick, you can really kind of take a step back and study it and pay attention and say what was true at the beginning is not necessarily true now. But what
Well,
we do know is that African Americans are disproportionately being impacted by this because of underlying health conditions, and that includes underlying social disparities also. And Dr. McIver, you were about to say something.
I was about to say you're exactly right. What first captured my attention was when I not captured attention, but really kind of captured my attention was when the NBA players started starting tested positive.
Mhm.
And being a
Mhm.
sports medicine physician, you're talking about NBA player, one of the most well-conditioned, healthiest people on the planet, an NBA basketball player. And so when they got it, and then another one of his teammates got it, I was like, okay, we're going to have some problems here.
Yeah.
Because it wasn't just older folks like they were saying at one point in time. You're getting healthy people, professional athletes that's getting this.
Yeah.
And that's kind of when it really kind of, you know,
The light, it was like whoa, whoa, like we got to really think about this.
I
Dr.
think
Bessellieu. Yeah, go ahead, Dr. Bell.
I think Dr. McIver is absolutely correct. I think that sent a major message to young people because young people think that because you're a professional athlete, you cannot get sick and you can't die. That's the furthest thing from the truth. All right. I'm well, being old school. I remember I'm blocking on his name. Um, Ernie Davis. You may not remember Ernie
right.
Davis, but
Syracuse.
Ernie Davis, the first Heisman Trophy winner died at age 20, 21 or 22, had just been drafted by the Cleveland Browns to be a first round draft pick. He was going to be running with Jim Brown, best 1-2 punch in the NFL. Got to training camp, and his workouts were very intense. They thought they had made a mistake. He died from leukemia. He died from leukemia. I remember it made a significant impact on me because I was a young athlete at that time, and I was under the impression that if you were an athlete and in good shape, that you couldn't die.
Right.
So I think that Dr. McIver's point is very, very important. I was just reading today that Dr. Fauci was somewhat impressed that the NBA basketball players are going to be playing in a bubble,
right,
going forward, and of course that means that nobody will. Well, when they play basketball, nobody will be in the gym but them, and anybody that comes into their space is going to have to be tested going forward.
right.
So, Dr. Bessellieu, coming back, and I'm going to bring this back around full circle since we've been talking about these young folks and not realizing that they can too get this virus and get sick and die from it. And we're coming upon an hour also. So, Dr. Bessellieu, your thoughts regarding, once again, these young folks and where they are right now regarding this virus. And I think one of the issues is that it's invisible. We can actually see racism, especially now with police shooting unarmed black men. But this virus is invisible to us. So, any thoughts, Dr. Bessellieu, that you have? I think she has a delay. Leslie, can you hear us?
The main thing that
There
I
you go.
would say is to get more information, do your research, find out from reputable medical resources what the numbers are. Don't rely so much. Yeah, I can. You're not.
Okay.
Yeah, you got a delay, Leslie. You might have to back out on me and come back in here. Oh, now I think she's frozen. All right, hold on 1 second here. All right, Dr. Bell, Dr. McIver. Um, so regarding let's go to some of these questions really quickly. There's some good questions here. I don't know if you can answer this one, but we're going to put it up here. What are your opinions on the capitalization within hospitals to diagnose Medicare patients with COVID for higher payouts? Or can you even answer that? Now, that's a loaded
Sure,
question, Dr. Mack.
sure. Not really. Not really.
Not
It's not really
really?
loaded. Yeah.
Okay.
Listen, if these people have COVID, they're going to require more care. And it's going to require more care, bottom line. So, I get it. I mean, I'm not so much so concerned about capitalization on a hospital. I just want these people to get better and get well. I mean, there's a whole financial side of this that we're talking about, but to me as a physician, all I want is whatever it takes for these people to get well, whatever services they need, and that's the kind of bottom line to it. I mean, I that that
I think I agree with my colleague. Um, this question though reminds me that South Carolina needs to accept Medicaid expansion.
right,
As a result of us not accepting Medicaid expansion, the very patients that we are talking about,
right,
those are the patients that need that their illness would get paid for if we had Medicaid expansion. And South Carolina, along with about 11 other southern states, does not accept Medicaid expansion.
Right.
So, for no other reason, the COVID situation drives home
Right.
that if we had Medicaid expansion, then we would be able to take care of marginalized, underserved, pregnant
Right.
children, and poor people.
Right.
And I'm kind of like Dr. McIver. The finance part of medicine is probably my weakest point because I really don't care about that. When somebody walks into my office, I don't know whether they have insurance or not. And I really don't even look at that. I pay
Right.
somebody else to look at that. I'm
Right.
really centered on taking care of people.
Right.
But it's an excellent point
It,
because it's one that has to be addressed.
it is. And Maryland, just for the audience that may not quite understand that, when President Obama was in office, there were certain things that certain states had to do to get matching funds from the federal government
Mm-hmm.
to expand Medicare. When certain governors did not do it, mostly Republican governors who were trying to be, obstinate when it came down to things that President Obama was trying to get into place. South Carolina and the then Governor Nikki Haley did not do the things that needed to be done, and hence South Carolina didn't get the expansion of Medicaid. What that meant was that the money that South Carolina had for Medicaid had to be divvied up amongst a lot of people because they weren't getting matching funds.
Mm-hmm.
Hence, what ended up happening was a lot of women, children, elderly, and handicapped ended up getting pushed off of Medicaid. For some
Mm-hmm.
people, as much as getting $500 too much a month. So when that happened, there was a large percentage of people, and I used to know the numbers at one time. There was a large percentage of South Carolinians that got kicked off of Medicaid.
Mm-hmm.
And as Dr. Bell said, these are the people that are living a lot of times in these rural communities. They have more health issues. They have poor access to health care. They can't pay out of their pockets a lot of times. So doctors like Dr. Bell and myself have to, work with them the best way we can to get them that care that they need.
Yeah. Yeah, they fall in that gap and you don't think about it, but it is happening and it's the result of us not expanding Medicaid and it's that I don't want to call it a sweet spot, but it's certainly a healthcare gap that
Right.
people are falling into, and the pandemic is really just opening it up and
Right.
really showing to us what the lack of access to healthcare does. And
Right.
and I do want to mention, go ahead, Dr. Bell.
One of the things that I should also point out for those of us who are in the healthcare profession, it was not a political issue. It was not a political. It wasn't. It wasn't a political issue for the hospital that Dr. McIver practiced at. It's not. It wasn't a political issue for the medical university or for Roper St. Francis Hospital or for most healthcare uh, people who took care. We recognized that this was a major blow to taking care of marginalized and underserved people.
Right.
Yeah, and you can only push it so far down the road until it catches up with you. And unfortunately, the pandemic it caught up with us, and
Right.
people are getting sick and dying unnecessarily because we didn't make decisions. And this is a political comment. We didn't make decisions that really were benefiting people of South Carolina and the other states that did not expand Medicaid. And now they're paying the price for it. Those of us who have health insurance are going to probably have better outcomes. And that's actually on a regular day. If you have health insurance and you use it, you should actually have better outcomes if you use your health insurance. But there are a lot of us out here who don't have access to health care, and they're paying the price for it. Unfortunately, they're paying a price for it. Now they're calling them essential workers. Yeah. All right. So I want to mention because Dr. Bell has some pictures, and also we from Federal Healthcare, but I want to also mention that St. James Health and Wellness, formerly known as St. James Family Health Center, they are doing free testing at all of their sites in Georgetown and Charleston. So if you could get to St. James Health and Wellness, go ahead and get yourself tested if you want to. And then Dr. Bell, you were actually mentioning to me earlier that you donated some face masks to Federal
Well,
Healthcare Network.
yeah,
So
well,
tell us about that quickly.
well, we were very excited about. We were able to donate 1,000 masks to the members of the Federal Network Health Center. And so these are pictures in which I spent my day Friday going around donating. This is a picture at the health center in Somerville that was named after me. And so we went there, and we also went up to the health center in South Carolina, and then we are going to donate the rest of the face masks to the health centers around that are served by the Federal Health Network. So, in addition to giving people food, which we've not started doing, but we're going to try to do that. But we also are going to try to donate masks. And I might say one other thing too, to remind people the proper way to wear this mask. Dr. McIver, you want to tell people the proper way to wear this mask, man?
You go ahead, Doc.
I'm gonna model while y'all do.
Okay. Well, one of the things that we want to remind people is that in order for the mask to be effective, it must cover your nose and it must cover your mouth. And it would be nice if there was a nice seal around your chin here. So the purpose of the mask is to keep the droplets of other people coming into your space, and that's where social distancing plays a role. So I see people. I see people all around Charleston and different stores. They got the mask down here, and some of them got the mask around the neck. So we just have to remind people that if it's going to be effective, it really does need to cover your nose and your mouth and have a nice seal. And if you can, try not to put your hand on it all the time.
I've been wanting to do that for weeks now. Just demonstrate. So thank you for the opportunity.
And let me say something about the gloves. Please don't wear these gloves all day long. I mean, people are putting on a pair of gloves. They're going to the grocery store. They're touching the grocery store. They're going to pump gas. They're touching handles everywhere. Then they're going to the grocery store, touching a gallon of milk, and then somebody else coming behind it and they touching it. So I'm going in the grocery store with my mask on, and I'm almost having to touch the meat because I can't even imagine how people touch that meat already. And some of them had on all day. So if you're going to wear gloves, that's okay, but take them off when you go from one place to the next, because you're just carrying it from one place to the next.
And Marlon, one final thing I noticed that one of a question that was asked, they suggested that the information is somewhat complex. One of the things that I would remind, particularly African American patients, if you're going to a doctor, use your doctor as the source of information. Don't get your information from out in the street. I can't tell you how much time I spend when I'm doing these telehealth visits, debunking information that people have put out in the street from people who are not even healthcare professionals. Dr. McIver, Dr. Bessellieu, and myself, we have spent a lifetime learning about these health issues, but yet still our people, African Americans, will get information from people who don't know a bit more about what they're talking about than the man in the moon.
Right.
That's very true. Very true. I see that in myself. Dr. Bessellieu, you may have something to say about that also, because I'm sure there's some psychology behind that too. Do we have? Are you back here, Dr. Bessellieu? Thank you for getting back in. Appreciate it. Yeah, we still got your hesitation in that
Right.
audio.
Well, before I, okay. What, can you hear me at all though? That's the main thing.
Yes.
Okay, I would just reiterate, yes, find out first and foremost, check your information with your medical provider. But by and large, get information from reputable resources. And I don't mean a site that looks like a medical site on Facebook, but really, look at those tested and tried medical resources, and even call your doctor's office if you can get some information from. But many times your physician's offices and even some of the our healthcare offices and even the mental health offices will have current up-to-date information about COVID-19. So if that's what you're looking for, then make sure you start there until you can actually, get in front of your doctor where you can get some, where you can verify some of the information that you're hearing.
One of the things that I have noted, uh, by no means am I a politician, but I have noticed that Dr. Linda Bell is doing an excellent job in giving out information. But one of the things that the people of South Carolina must realize, Dr. Bell gives her assessment, which is fact-based. The governor gives his assessment,
Mm-hmm.
which is based, and his interest is entirely something else.
Mhm.
His interest is politics.
Mm-hmm.
Mhm.
So you got to be able to separate. And so sometimes the two things very well may not jive. We've seen that on a national level with the president and Dr. Fauci.
Mm-hmm.
We've also seen the same thing
Mm-hmm.
with our governor and with Dr. Linda Bell. She's kind of caught between a rock and a hard place. Sometimes I
Yeah.
watch her as she's giving these press conferences and she's trying to be politically correct, but
Mm-hmm.
sometimes it's very difficult to be politically
Mm-hmm.
correct if you're a physician and you're telling the truth, because we've been trained to give
Mm-hmm.
facts and we are not politicians for the most
That's
part.
right.
Very true, Dr. Bell. Dr. McIver, I see that you
Mm-hmm.
wanted to say something too.
No, no, no. I agree with 100% what Dr. Bell's saying. I mean, she's it's in between a rock and a hard place because our first oath is the first do no harm. So in saying that, you have to be truthful. You should be truthful, forthright, and and um and on point and factual with what you're saying. It should be evidence-based medicine. In other words, we can give our
Yeah.
opinion to a certain degree, but what we're saying is evidence-based. It's studies that back up what we're saying. It's numbers that back up what we're saying. That's what we mean by evidence-based medicine.
Very true, and it is very true that we do need to listen to our doctors, even when they come on um, shows like this, a gathering place to talk. These are trained professionals who are sharing, who care about their patients, who care about their community, and they're here to share their knowledge based on scientific fact because they really care. And I'm glad. I want to thank all three of you for coming on today and sharing that information. And this is my means of just letting my community know what they need to know so we can combat this virus. And a show that we had earlier with Dr. Baryam from the End Coronavirus, the WHO group, that global group, said we can shut this down if we shut down the country. But unfortunately, I think that door has been closed from the politicians. But it has not been closed for the individuals when we look at our behavior and what we can do to end this virus. And this is why it was so important for me to bring Dr. Bessellieu on, who could speak to that psychology of why people are not wearing the mask, whether they're young or older, why they're not practicing social distancing. And just because the governor opened the door or the president does not display the best behavior when it comes to face masks does not mean as individuals we can't make the best decisions for ourselves, our families, and our community, because that's what it's coming down to, folks. It's coming down to listening to the medical experts, the scientists,
Mm-hmm.
and making the best decisions as individuals, because I really truly believe they're trying to normalize this virus as something we have to live with. And we don't have to live with this virus. It can be eradicated. It has been eradicated in New Zealand, for example, and some Asian countries because they shut down and they used the face mask. They practiced social distancing, and they also did a lot of public sanitizing, which I have yet to see here in the United States. So I want to wrap up with that. But any last thoughts from any of you? And I'm going to start with Dr. Bessellieu. Dr. Bessellieu, any quick last thoughts as we wrap up the show today?
Just from a mental health perspective, I just think it's important that people take care of themselves. So in addition to, finding out the best and reputable sources of information, limit the amount of media coverage of the virus, the protests, everything else that causes your stress levels to rise. Just limit the amount of media consumption and do what you need to do to take care of yourself. Because as you bring your stress levels down, you'll find that you'll feel better mentally and you'll be able to take in information. You'll be able to discern the truth from the lies, particularly as you start listening and finding out what are those reputable sources of information that you can rely on time and time again. Really what's going to help us. And then as you learn, pass on the good information, pass that on to your family, your friends, and your communities.
All right. Thank you, Dr. Bessellieu. And that means y'all need to come watch A Gathering Place because we're reliable. That was a shameless plug. That was a shameless. Dr. Bell, do you have any last thoughts?
No
Uh,
worries.
well, first of all, again, thank you very much for asking me. Um, I, I guess I'm wondering what's going to happen when we get the vaccine,
Mm.
quote unquote vaccine. And I've already started thinking about, is it going to be an issue for African Americans? And the reason that I say that is not because of the vaccine itself, it's because of our history with vaccines and whether or not we African Americans are going to trust whether or not the vaccine is going to work. Already I'm beginning to hear and people are beginning to ask me whether or not I think it's going to be a certain amount of experimentation with African Americans taking the vaccine. So I don't know the answer to that question. The only thing that I can say is that I'm going to be looking at that information very, very closely. And I don't know whether or not I'm going to be the first to recommend that my patients get the vaccine. I may do just like I do with other medicines that come out first. I may wait and see what's going to happen before I recommend that we, give Black people vaccines.
Well, Dr. Bell, I am one of those who's along the lines of I actually would take the vaccine, but I would not be the first to take the vaccine. I'm just gonna be honest, but I don't have because I'm a military brat. I grew up taking a lot of
Yeah,
vaccines,
right, right.
a lot of vaccines, because we had to travel all over the place, and I don't think other people may disagree, but I don't think I've had any lingering effects from that. But
Yeah,
but yeah, but
I
common
feel
sense
you.
tell me that
Right.
I need to sit back and kind of wait. But I have no problem taking the vaccine. But it's a good point that you're bringing up because I've been hearing people saying I'm not going to take the vaccine. But I also think that comes in part of because of the disinformation that's been floating out there also. So hopefully that will change as we get closer to a vaccine and it goes through the process it needs to go through. And since you mentioned vaccines, I want to put this question up that vision walkers, are you all willing to have conversations with your colleagues who are successfully treating COVID-19 patients with alpha interferon? I'm hoping I pronounced that correctly from Cuba. And I don't even know if you two are aware of that, or if
Yeah,
you are,
yeah,
can you
yeah.
explain it to us?
Well, alpha interferon has been used for a number of different things, including hepatitis C. And physicians in Cuba are using this. Um, I certainly would be interested in hearing their data and hearing their numbers. I had the pleasure of going to Cuba this past summer with Coastal Carolina women's basketball team. We were in Cuba for 7 days. I got a chance to interact with physicians in Cuba. And I know that Cuba has a very robust research and medical infrastructure. They put a lot of emphasis in that. no doubt about it. And I truly believe they probably got some really good things and maybe even some cures for a lot of things in Cuba. Um, Again, I was there for a week this past summer and was impressed with the medical part that I was able to gather and learn from interacting with my colleagues in Cuba on a daily basis. Actually, when I was there, so certainly I'd be willing to to hear that and hear numbers, that kind of thing. So that's not a problem.
All right, very
Yeah,
good.
yeah.
Very good, Dr. Mac. I'm looking forward to hearing more about it then. That's something I'm going to keep my eye out on
Okay.
then, since you have such a knowledge of
Okay, I think she froze. Um,
Mhm.
you good, Marilyn?
Yeah, I'm here. I'm back.
Okay. Um, again, Marilyn, I want to thank you for inviting me again from coming on, and it's certainly good to be on with Dr. Bessellieu and my good friend Dr. Bell. Just in summary for me, like I said earlier, 3.9 million people worldwide have recovered from COVID-19. 180, 820,000 people in the United States have recovered. But some of the latest studies and projections that came out earlier this week saying that there could be as many as 100,000 more cases by September. Will that happen? I don't know. Only God really knows that. But I do know that with the fact that people have recovered, if we do the right things and we do them the way it should be done with social distancing, masks, we can halt and slow this down. We are the virus is the constant and we're the variable. So if we do our part, we can help slow this down tremendously. But we've got to do our part. Thank
Thank
you.
you, Dr. McIver. And I want you to know I have been repeating that to a whole bunch of folks. The virus is the constant, and we are the variable.
Right.
So you have gotten that drilled into my head. So thank
Right.
you very much.
You're
I
welcome.
want to thank all of you. I want to thank Dr. Bessellieu for joining us today and giving us the psychology of what's going on, a little bit of her expertise. Thank you. And also Dr. Bell and Dr. McIver, please thank you for joining us. And I
Thank you for
encourage you
having
to come on back. You know I always want you back. So look at your calendars and just let me know.
me. Okay.
Because I think this is going to be with us a while. But we also need to talk about our health disparities and the social disparities that have put us in a place where we're disproportionately impacted by COVID-19. And Dr. Bell and I have been trying to pull something together. Yeah, and we're gonna do it, Dr. Bell. We're gonna do
We're
it.
gonna do it. All
We're
right.
gonna do it. But I want to thank all three of you for joining a gathering place today, talking about the rising numbers of COVID-19 in South Carolina. This has been good information. It's been a great show. If you guys have questions, drop them into the comments. I'll make sure that they all get those questions, and then we'll get them answered to you. Visit us at GullahGeecheeChamber.org on our website, and you could join us. We're running a COVID-19 special. You will get, instead of 1 year membership at $150, you will get 2 years, because we are out here helping our businesses grow, and we know this is a stressful time for everyone, and we want to make sure that you have the opportunity to get help from the Gullah Chamber of Commerce. So we're going to give 2 years instead of 1 year for $150. And next Sunday is going to be our Father's Day special. We have a show on Wednesday at 4 o'clock, but we also have our Father's Day special next Sunday at 4 o'clock. If you want us to share a picture of your father, please send it to the Gullah Chamber of Commerce at Maryland at GullahGeecheeChamber.org, and we will include him in our musical tribute to fathers. All right, everyone, thank you for joining us today. This has been A Gathering Place, brought to you by the Gullah Geechee Chamber of Commerce. Thank you for joining us, and thank you for our special guests. And I encourage the three of you to enjoy the rest of your weekend. Thank you, and you're much appreciated and much loved.
Thank you.
All right. Good night. Good
Good
night,
night.
everyone.